sort of begin by thanking the organizers for inviting us here. The basic idea of this session is more interaction and more learning from our very learned panel members. What I will quickly do is I will request each panel member to start with about 1 or 2 minutes of introductory remarks, what they think is important. The topic is on how do we use technology for providing excellent care. And also they are managers of their hospital, CEO, so give some insight into how do we improve management. Because we heard how to improve patient care, how to improve doctors' sort of time management, etc. we will hear. So I also want to encourage them to talk about how they are using this technology or can use the technology to improve management of the hospital as well as patient care. We have only about half an hour maximum, so we will request everybody to keep their introductory remarks short for about maximum 2 to 3 minutes because we have 5 very learned people. I will also ask them to start with their brief introduction, including their hospital a little bit, and then go on and give your points. And then we will have question answer. So we want to keep at least 15 minutes to hear from you. What are your questions, comments? Let me begin by just saying that few years ago, when all this technology was new, I met a Holland doctor. He started saying that he has now stopped practicing. I said, why? He said, become very difficult to practice in Holland because patients know more than what doctor is updated. So he said, I have now become sort of non-practicing doctor. So I think if we don't keep updated and ahead of our patients, we may have that problem sometime coming. So with that brief comment, let me begin with sir, maybe self-introduction and then give your comments. But very
thanks,
brief.
Dilip bhai. Thanks a lot. Thanks the whole organizing committee. Actually, I'm Dr. Dhaval, cardiac surgeon. Actually, I'm not really a management guru. So I sincerely beg your pardon. Actually, I might not be knowing as much as you guys, but I'll try my best. Now, healthcare and IT, now it's inseparable actually. We have a lot of discussions been happening since morning. A lot of inputs been coming up and it's yet to come. Let me tell you, when you talk about the hospital, I broadly divide into 5 subjects actually. When you take the IT industry in, that's one is health records that we had a lot of discussion. We have a subgroups that we'll discuss later. Second thing is clinical continuity with the patients actually. In the OPD, in the indoor, in the OT, in the ICU, in the ward, everywhere. Third thing is accessibility. It's a both way. The patients who can access hospitals and doctors they can access all the patients. Fourth thing is health education. We have a lot of things been happening in that also that we can discuss actually in this one. And the last thing is health promotion by various ways. So these 5 perspectives we should consider, and if we take an advantage of IT, then I think we get lots of things from it. Obviously, it's not a job for one doctor or one management person. You need a whole team. And there are some things, a disadvantage or pitfalls you can say that, it is a bit important also to bring everything actually to the peripheral centers also. That also we'll discuss later on. Thanks.
Hello. Kadvi sir. One more point, please. What Dhaval sir has said, I want to add one more point. That the coordination between the doctors in corporate hospital who are treating patient. See, in corporate hospital, there are multiple issues and multiple morbid and comorbid conditions. So coordination, in between coordination, there has to be some solution for this coordination also. So suppose one patient, 4 or 5 faculties are treating one patient. So there should be some software, something like that. Okay, whosoever changes the treatment, whosoever is getting the investigation should go to the all doctors.
I absolutely agree. Actually, I've been practicing the same way actually when I was in Sydney, where all the patients been categorized when they were used to be at primary center actually. And they have been decided there only, where should this patient to go actually. by hospital wise, need wise, anything. But now we have, certain drawbacks actually in Indian health system, and that it has to be cover up first, and then only we can organize all things. I'm not criticizing everything is possible actually, but it needs bit of a modification, bit of a repo, bit of a coordination. So I agree, we can include all these things actually in discussion. Thanks.
Sure. Dr. Gadvi, please start with your introduction. So,
Morning everybody, I am Dr. Bharat Gadvi. I am the CEO and Medical Director at HCG Hospitals, HCG Group of Hospitals for Gujarat. Rather than discussing anything, I am going to just put forward some of the issues which we need to discuss. We all have been talking about IT and all of us are becoming more IT savvy, but actually we are using maximally the SMS and WhatsApp. I have seen in my hospitals when I have to communicate with the consultants, most of them do not read emails. We have to give them both written mail as well as emails. They don't read. There are some doctors who do not know how to write emails. They just wait for somebody else and do it. It's a fact. So Dr. Darbar also knows. So we need to ensure that, I may call it generation gap. Maybe the younger people are more attuned to use of technology. At the same time, the younger generation, by using the WhatsApp and SMS, the text that they are using, they're using those same text in the records, medical records. Writing histories has become more of like SMS text and WhatsApp text, which is going to be really difficult if there are any legal issues. So these are the pitfalls of using WhatsApp and SMS and other IT technology. The other thing is we have been sending like ECG images or X-ray CT scan images through WhatsApp, and the cardiologist at home can immediately send a diagnosis. But this is definitely a double-edged sword. By chance, if a wrong ECG goes, then it can really result into a trouble. So there is no standardized process for that. We need to develop that unless it is documented by two people, maybe two separate persons sending the same image to that doctor might help. Availability of HIS. I have been looking at various HIS. Still there is a huge limitation about HIS. The best brains of information technology are in India, but they are all doing good work for the Western countries. They are not producing good softwares for our own country. Most of the softwares are not able to do the functions that we want as managers of the hospital. There are a lot of limitations, package issues. All these are definitely a hit for using IT maximally. Same way EMR, like whoever are developing EMR, either they are not taking help of right people. They go on describing a lot of things. We have been now used to doing things easily rather than simply with the help of IT, which is not required. I think we want to simplify things. We don't want to ease the things. Let us ensure that whatever EMRs are being developed, they are useful in our practice. They are relevant to our practice. They go on giving a lot of options, but which are difficult to implement. So implementation of EMR is going to be a major responsibility and challenge across the hospitals. Again, reluctance of the consultants. Even documentation part, they are very reluctant. So I'm sure using technology for documenting in EMR is going to be a much bigger challenge. So it's all good when we talk about IT, but when it comes to reality, most people, even the employees, don't use it. I have developed small modules for, say, ambulance booking, vehicle booking, auditorium booking, but I had to personally intervene to make sure that everybody uses them because it's going to really make their life simple. But there is a lot of reluctance, resistance from everyone to use the technology. I don't know why. They're still used to the pen and paper. So that mindset has to change. Probably medical education, you should introduce some topics which are related to IT, and that may make a difference. Otherwise, WhatsApp is mostly used for chatting and airing public opinions and discussions and debates.
Yeah.
Thank you.
okay, thank you, sir.
Well, good afternoon, ladies and gentlemen. I'm Ravi Bandari. I'm an engineer by profession. I'm heading Shelby Group of Hospitals as the CEO. as we talk about technology, this is something which has been influencing our lives. Various walks of lives are being influenced by technology, and for that matter, healthcare also is in a large way getting influenced by it, which is definitely in the benefit of the patients and a step towards providing a much better or excellent healthcare. If it start with a simple point like the initiation of a patient's disease, where the patient starts to look after where to go, gone are those days when you used to go only to the family physician or the nearby nursing home. Now people are smart enough, they do a lot of Googling, they try to find out which are the better hospitals, they do a lot of online shopping, we can kind of call it. And recent study suggests that there are 61% of the patients who before going, I'm not talking about the normal ailments, before going for a treatment, they do an online search. So that is one very important aspect wherein all the hospitals, all the doctors need to be very active on the various social medias which are available as of now. Another important point is in terms of providing excellent healthcare services, there's something called EMR, which Dr. Gadvi also talked about, or the electronic management records or the electronic health records which we talk about. Now there's a lot which need to be leveraged on that as well. We have these records available, the data are being recorded, but again, a study suggests or says that there are only 6% of such records which are actually effectively used. Rest all are just dumped in the computers, they stay there forever, and I don't know if anybody looks at it or not. Yes, there are some researches going on in the Western world wherein they are trying to come up with some kind of softwares which will really do a lot of analytics around such EMRs or EHRs, and that is where probably the usefulness of such data will be much better and will be handed to the patients as well as to the doctors. So that is about the EHR. Another important aspect in terms of providing good healthcare services is the HIS. As Dr. Gadvi also rightly pointed out, there are different hospital information systems which are available as on date. I don't think anybody can say that yes, we have got a complete solution for you, in spite of so many big companies working on this for so many years. This may be because the medical world is evolving in such a way, in such a fast manner, probably to keep a pace with that. It has still not happened, and I don't think any hospital or any hospital administrator today is fully satisfied with the available HIS. Having said that, the HIS in whatever form is available is of a big...
Can you speak in the mic? People at the end cannot speak, and you have finished 3 minutes, so I'll give you half more minutes, and please.
Yeah, I'll just talk about this.
Yeah.
So this HIS gives a lot of information, or online information, which can be very handy, very useful. So obviously, in spite of whatever shortcomings are there, it is a must thing to have in the hospitals. Thank you.
Okay, thank you, sir. Yes, please.
Good afternoon. I'm Ramesh, representing Apollo Hospitals. We have been talking about HIS and data analytics, EMR. In my opinion, it is in the evolving stage. What goes in comes out. Most of the HS, if you look at as an administrator, we find it very difficult, the end users, the doctors, unless you use them effectively as the end user, the data is incomplete. As administrators, HIS is helpful to us in data analytics, in epidemiology, mapping, to a certain extent, publishing papers by our doctors. Recently, we have, in the group, Apollo group, we have tried to create a health highway within the group. Like, all the hospitals, all 65 hospitals of the group is going to be put on a health highway where through the technology, the data is going to be collated, and that with such a huge data, huge, cutting across various diseases, that is going to be of great help in terms of research and data analytics. Coming back to the technology which is helping administrators or CEOs or hospital managers, in my opinion, it has helped to a greater extent in addressing the accessibility issues in remote places through telemedicine. Definitely, yes, telemedicine with proper software attached to it. We can do away with a lot of these change of data and all that. Health education is another thing which definitely this technology is helping us. Since it is evolving, I won't really say it is of this current technology in terms of health record management and HIS is helping us to ease our work. But as of now, it is doubling our work. I think as it evolves, I think it is going to be helpful to us. And it all depends on the doctor's support to us, which is important. Thanks.
Okay, thank you. Sir.
Thank you for having me. I'm Rohan Shah. I'm heading the IT department for Zydus Group of Hospitals. And sorry, Dr. Sajan Nair, CEO of hospital, could not make it, so I'll be representing him. So the next decade is going to be the game changer in healthcare industry, especially in the information technology. And I believe that that HIS and the computers are, the hospitals are not limited to the HIS and the computers. It's gone way beyond that. And we at Zydus Hospitals started as on the top of HIS because hospitals are not limited to operations any longer. It is all about the patient's experience at the hospital, that how patient is experiencing and what the best service, because they are going to be the mouth of the word for the hospital. So what we have done is we capture a lot of data in EMR, we capture a lot of data into operations throughout the admission to discharge process or whatnot, all we do. What do we do with this data? We capture gigabytes of data, and so we have started in-house development of analytics, which is called a bioinformatics, which is we use the biostatistical models to analyze those data, to find the outliers, to find the gap in the processes, and how we can improve that process. For example, my admission process, my discharge process, how do I reduce the time, the patient waiting time between the two tests or procedures? How do I make sure that patient discharges most efficiently and patient has the best experience in the hospital, so he wants, so that's all we have tried to use technology for. And also we have started initiative in the ICU management information management system, which is one step above HIS, where the doctors can have. Now the mobile technology has powered so well that we can interface our ICU monitoring system directly with your cell phones, your mobile applications, and doctors or intensivists directly can monitor their patients wherever they are and make sure that the patients get the best treatment. And that's what we believe in, and we have moved forward with that. So I think the technology, as a hospital, we have to keep the technology with us for the next future and make the best use of it. And I think we will be doing very well. Thank you.
Okay, I think thank you very much. Very interesting set of panel with a lot of experience. I think what we are seeing is a starting of a new revolution. When we were medical students, tablets were to be eaten. Now tablets have to be programmed and worked, and cloud gave rain. Now cloud doesn't give rain. When people talk of cloud, it is something else. So I think we are in a very rapid change, and there is a whole generational change which is happening, as Dr. Gadvi said, the younger doctors versus older doctors. final point is, I think, how do we make the patient safe, better cared for, at a lower cost of money and time? I think both are important in modern times. Money is important as well as time. So I think one of my questions to think about is, are we saving patients time? Second is, are we giving a continuous care from a general practitioner to a hospital or to a consultant's practice to a hospital, back to a consultant or a general practitioner? So are we getting all this? Because currently main problem of our sort of private public is everything is fragmented. There is no continuity of care. So how do we develop that is one direction we have to think. Second is, do we develop a long-term patient record and outcome? See, finally patient is interested in what happened over 1 year, 2 years, and many of people have chronic diseases. So think about lifetime record and what is the outcome of that. And finally, there is a whole new set, and Dr. Malpani showed some of it, remote monitoring, remote pictures, remote everything. So how do we integrate that in our cell phones, computers, etc.? So I think with these three, I will ask Sir to give some comments, and then we will ask if you have any comments, suggestions and questions.
First of all, thank you all panelists. For HIS, I would like to say that since today, we have seen that most of the companies who are developing, they don't have our medical expertise. So we people should encourage our doctors to come into the IT field. And if they people come into the IT field, then all these problem and solutions may be solved. Second thing, what Gadvi sir said about this using of online reservation and all that. I will give one small example. I think 2 or 3 years back, for this getting this gas bottle, we have to phone or we have to go to that place. Now the Narendra Modi has digitized everything. By just clicking phone, there is electronic reservation, and you have to enter your mobile number. Once you dial that number from mobile, and your gas is reserved. So this sort of thing must come out. Third thing, I definitely agree with Dr. Bhandari that research data, the data which we are keeping in gigabyte is not used properly. We doctors should think of this data to be used for a research purpose. That is the, I think, key message. And the last one is a data of patient for a lifetime. I think it is very important, because if we see that lifestyle disease like diabetes and everything is coming up like anything in India, and people say that India is the capital of diabetes. So if we want to prevent this sort of complications, lifetime data of any patient will definitely help us to improve their lifestyle and quality and treatment. Thank you.
Thank you very much. The floor is open. Questions, comments. Sir, please introduce quickly. Can we have a microphone there, or maybe speak loudly?
Good afternoon, everybody. I am Dr. S.V. Kulkarni. I am from Mumbai. One of the biggest problem with all the corporate hospitals and the present healthcare is there is no uniformity of the patient's data keeping. You don't need a complicated system what all these hospitals are having, where for one patient you need sometimes 15 to 20 minutes to fill all the data. It is a matter of practice, I understand. But you can start with some simple databases, which will be one A4 size paper with the standard Excel formats. You decide first 5 lines for the demography, next 5 lines for the past history,
sir,
personal history.
I think we don't have time for explanation. We got your point, saying
Correct.
uniform data
Uniformity is
sharing,
most important.
Standards and doing and make
And
it
you take
as
help
simple
of-
as possible.
take
Let
help
us
of the
have few
national
questions,
organization.
and then I'll ask the panel to respond. So please, if you have, write down or use your smartphone to enter the questions. Okay, anybody else? Sir made a very nice point. Yeah.
We have seen that all the corporates are trying hard to work in the area of technology individually. Would it not be proper for all of you to sit down together, have a group, and apply whatever is good to all the hospitals simultaneously? We should create a larger data.
Interesting. Yeah.
Yeah, Dr. Dhruv.
You want to respond now, or we
Thank
want
you
to
for
say-
I can respond now or what?
Okay,
I think it will be easier, otherwise it
If
will be
you
lost.
have, please raise hand so I know how many more questions are there. Then I'll ask the panel.
We
So
have
please
already
raise hand.
formed
Okay.
an association of healthcare providers of India, and all the corporate hospitals have just got together. It's just 1.5 years. And yeah, gradually we are taking up each issues. There are more pressing issues than this. So we are taking up those issues first. And I'm sure it's a good suggestion. We'll definitely take it up. But to ensure that everybody uses the same database or is going to be difficult, because everyone has their own views, which one is important, etc. So there are a lot of variations going to be there.
Sure.
But definitely we can get together, we can share best practices among the hospitals. Yes,
Yeah,
sir.
yeah. Doctor, yeah, please, sir. I am the chair, please. Yeah, Dr. Nimish, please raise your hand. I'll give you time, I'm sure. But Nimish, this is not a technology question, so I'm sorry, it is an important question. But technology misuse maybe you can raise, but we get the. Yeah. Sure. So review of medical decisions and audit. That is his, I think, key point. Sir, you wanted to say.
Dr. Gadvi and Dr. Kulkarni, what he said, that should be a standardized database. What has, US people have done, they have standardized database. If I'm a general practitioner, if I add something to my patient, that will be available for everybody with consent of the patient. And even patient can be added as a module. He can have his own data to share with other practitioners.
Sure. So national standards for data which is being developed. Sir.
Just a minute. Here I would like to add, it's not the hospital and patients who are the stakeholders. Insurance companies are also major stakeholders, and now a lot of information what they want also have to be in the database. So I think everybody will have to come together and evolve something.
Right. Okay, we'll show.
Everybody is right.
Yeah, please use the
Nobody is
microphone.
perfect.
Please use.
The reason is everybody is right and nobody is perfect because the reason is that we want to have a uniform and everyone wants to wear a different color. So we have a solution and computer never tells you do this only or do that only. ये भी चलेगा, वो भी चलेगा. Therefore, all 5 hospitals, if they are different, we have programs called E-Link. All the pathologists have different analyzers, but all the programs, softwares are using any analyzer and taking the input of data and giving a format which Dr. Bharat Bhai likes or which Dr. Mahesh likes. So what I say is, you do your program, I do my program, મારા ઘરમાં હું કેમ બનાવીશ, you have nothing to do, but we have E-Link programs, and in fact, some of my patients are of the kind, they do not, their only job is to link the 2 programs. So 10 program, 50 program, 100 program, એક program સાથે વાતો કરી શકશે. So that is what is needed.
Lovely.
And once you computerize,
I think
you are automatically making it ethical and honest.
Yeah. Last question, and then we ask the panel to respond. They have said some things. We need to close in about 3 more minutes.
What Dr. Booth Sahib told, that already exists, that is a special language known as HL7. So all these programs talks to each other for the transfer of the data. That already is existing with most of the HIS.
Yeah. Okay. Panel, if you quickly want to respond to some of the questions, mainly were uniformity. Some was on sort of patient review and checking the audit, etc., for ethical practice. Others issues, anything else comes to your mind? Maybe 1/2 minute each.
Well, a very relevant and a common point which has been coming around is how the data transfer happens between the GP to the hospital, from one hospital to the other hospital, pertaining to one patient. I think that is where this EHR and the next level where this EHR is going to with the Western countries, as someone talked about, is already reaching to those levels. I think that is where the synchronization of the data or the continuity of the data between various treating doctors will be available, of course, with the consent of the doctor. So that is the next step of the EHR or the EMR.
Yeah, I think I would sum up that we should not be absolutely gaga over the technology. We need to really understand, yes, technology is definitely important, but how to use the technology in a good way is more important. Secondly, I think everybody has forgotten that point, that if we start, at least the hospitals, if they start putting up their infection rates, morbidity rates, mortality rates, doctor ratings, I've not seen any hospital putting up those things. Probably that is going to be more useful to the patients. And they have to be honest, just, and ensure that they are not manipulated like the research data that most commonly is manipulated in our country.
Okay, anybody wants to make a last comment, because we are running out of time, so maybe just half a minute or less.
Yeah, IBM tried about 7 years back to create a national health highway wherein they invited all the hospitals and healthcare providers, including the insurance companies, to join. There are hardly any takers. So it is forthcomingness of all the healthcare providers, including hospitals, which matters. Then only it is an evolving stage. Maybe down the line, 10, 15 years probably will be there.
Okay.
I have one minute to
Just
actually have one small
15 seconds now.
Now that's a presentation actually made by one of very giant IT company for healthcare. So if you allow me 1 minute, I'll just summarize it.
Yeah, half a minute.
Okay. So this is actually what they publish 5 health trends actually in IT. This Accenture. The first one is internet use for the patient actually. So what is going to be the future is a lot of things patient can do by their smartphone or the devices, what they're going to be where, like they can request medicines, they can receive bills, they can select their insurance, they can comprehend everything. What about their health, diabetes or hypertension or anything? They can do each and everything from the devices, which is going to come actually, which has already come in USA actually, and so many parts, and there are 49% of patients actually, they started globally wearing all this thing and they started using all this thing, and 73% of patients, they are interested actually. So this thing will be the future. The second trend will be the economy, hardware producing healthy results. Okay, now the big problem in India is money. What Bharat Bhai and everyone said, we're talking of big things actually, but when you count money,
yeah, your
like
half minute is over, huh? So quickly, whatever
okay.
5 points, just 1, 2,
no,
3, 4, 5.
That's okay. But
yeah.
money, I must say, like if I want to make everything electronic in my hospital, it might cost around 25 to 30 lakhs actually per bed, everything electronic, and that is always going to be the troubleshooting actually in India. Trust me actually. So we have to be more practical things. We have to be more and more
sure.
In Indian way. So anyway, thanks for
thank you. I think very interesting panel. I was worried that his last point may be that there will be software which will make diagnosis. So doctors may not remain relevant. Patient can make their own diagnosis and take treatment. So I was worried, but that point didn't come. So hopefully we are in business for a long time to come. Thank you very much. I think the main essence is simplicity, and how do we make doctors and patients' life simple, more enjoyable, more accurate, and livable. Thank you very much. Thanks for your time.
Thank you, Dr. Dilip Bhai and Dr. Jaswant Bhai, and thanks all the panelists. And I request all the panelists, if you are not registered on Google Counter, please register yourself. Thank you, sir.